Hello, PHARMATIVE friends, and welcome to PHARMATIVE Live. This is our time to get together and share and exchange information regarding your healthcare and your family's healthcare. So welcome to PHARMATIVE Live. I'm Dr. James Partyyka. I'm an oncology research scientist, clinical pharmacist, and the founder of PHARMATIVE. So welcome. For those of you who are new to PHARMATIVE is all about learnings and socializing to exchange ideas and information to improve all of our healthcare. So I welcome you. PHARMATIVE.com is forever free and will continue to be forever free. And it's all about empowering you with information and education to improve your healthcare. So welcome. We have a very big announcement, a special announcement that I am going to be telling you at the end of this 10-minute segment. So stay tuned. Today, I am going to talk to you about technology and healthcare and the changing treatment paradigm which is occurring as technology is improving all throughout the world. And by that I mean we're in the United States changing from a transactional model of medicine to more of a continuous care of clinical care, clinical medicine, improvements in technology which will allow us to improve your health care, but also will allow us not only to improve your health care, but allow us to improve the efficiency of delivering healthcare directly into your own homes. So that's what we're going to be talking a little bit about today, which is a very exciting topic to me. I've always been interested in technology, and I've always loved utilizing technology through my smartphone or through my laptop or through my smartwatch. And I'm going to share with you a little bit of my own experience. So it's all good. It's all positive information about how technology is going to improve your healthcare and your loved one's healthcare. We're talking about improving patient outcomes by utilizing technology. And what do I mean by that? What I mean by patient outcomes are things like the number of patients that decrease or stop smoking, those patients that have a tighter glucose control on their diabetes by measuring hemoglobin A1C, those patients that may or may not have hypertension, but we're able to measure their blood pressure on a continuous basis, those patients that are overweight, which we encouraged to lose the weight because we know that increase in body weight is associated with increased morbidity, as well as, in some cases, mortality. That's all about improving patient outcomes. And the way medicine is changing in America is that we're going to utilize technology to capture important data. And so now I'm going to talk specifically about myself. I'm 57 years of age. I'm fairly healthy and happy. And I recently was shopping around for a new doctor in the San Francisco area. And I decided to hire Dr. Barry and his clinic to take care of me. And what's wonderful about his new business model, which is available in some of the other major cities in our country and expanding rapidly, is that they use technology to communicate to your smart devices, whether it be your phone or whether it be your watch. And then that information is then transmitted over into your electronic medical record so that they can assist and help you and monitor you. They also provide a 24/7 app so that if you're having a healthcare problem, wherever you are, you can get in touch with your care team and they can respond and treat you accordingly depending upon what your situation is. So I'll give you an example. I signed up. I had my baseline visit approximately 1 year ago. And with that comes obviously a physical exam. And they hook you up to a instrument which measures your vital signs, your blood pressure, your weight, your oxygenation of your blood. And with that, then they develop a care plan, monitoring plan, therapeutic monitoring plan for you. All good. And then they will send you home with wireless devices as needed to make sure that you're not only being treated appropriately for your healthcare problem, but also prevention as well. So preventing disease is the best way to improve your health care. If we can prevent additional complications, if we can prevent comorbidities, that's all about, again, improving your quality of life and improving your health care. So recently, I think I stated this a couple of episodes before, I was diagnosed with hypertension enough at stage 3 so that I required treatment. So they sent me home with a wireless blood pressure monitoring device, blood pressure cuff, and that transmitted my readings 3 times a week back to my doctor in order to decide if we needed to treat myself or not. And we did. So I was stage 3 hypertension, and after approximately 4 weeks, I started on a newer medication, one of the angiotensin receptor blockers, which has data which supports its ability to control blood pressure, but also improve patient outcomes. And I'm glad to say that after approximately 3 months on the medication, actually started working very quickly within a number of weeks. I now have my blood pressure controlled at a level which decreases my risk to cardiovascular disease and stroke. So that's all good news. And I did that through this brand new clinic, through technology, which I'm able to do at home, transmit the information to the doctor, all of my data, all of my lab tests, vaccinations, monitoring plans for high blood pressure, and I'm slightly overweight or a little bit more than slightly overweight, is all monitored through a wireless weight scale, a wireless blood pressure cuff, and I'm feeling fine and doing very well. And all of this, again, technology in healthcare is going to improve the efficiency of delivering healthcare at home and also improve patient outcomes, which is the end goal for all of us to stay healthy and improve our health. So technology in healthcare is tremendously important, and if you are technology challenged, you may reach out to a loved one, a friend, a work colleague, to see if they can help you get up to speed with the technology of 2018 so that we can all share in the benefits of improving our healthcare. So that's really all I have to say today. We'd like to keep Pharmative Live down to about 10 or 20 minutes. And I want to shout out, before I announce our big announcement, I want to shout out thanks and appreciation to Jimmy Mann, our creative director and my partner in Pharmative, as well as Karen Angelini, who is a writer and a contributor lead for our women's healthcare forum called Trending Pink, as well as our scientific advisors and the many contributor leads that we have across the country to make Pharmative as useful and as simple to develop very key, important messages which will affect you and your loved ones' healthcare. So that's technology and healthcare, that's Pharmative, and here comes the big announcement, okay? We are fastly, Pharmative, approaching 20,000 followers, and for us, that's a big, monumental milestone. And with that, we are in the process of acquiring our first formal digital recording studios in the Los Angeles area. And I'm very excited about it because it's going to allow us to produce more educational materials, but also produce more events, special guests. It's going to allow us to deliver the state of technology which Pharmative deserves. So all of that is coming in January, and I can't wait to give you a virtual tour of our new digital recording studios, which will only empower more Pharmative.com and allow our messages to spread across the world. So I want to thank you for your support. I want to thank you and shout out to some new members in Argentina and Peru, as well as Spain. And I'll see you next week. And in the meantime, stay healthy. Thanks.